So this video is for a Neurotox machine for the stroke ward at Twyford in Winchester, and we're here with the successful bidder. Nigel, would you like to introduce yourself, please?
Sure. I'm Nigel Smyth. I'm one of the stroke consultants here at Hampshire Hospitals Foundation Trust.
And can you just tell us a bit more about this Neurotox machine and what it does?
So within Hampshire, we have about 700 stroke patients a year from Winchester, Basingstoke and Andover. And a potential complication that arises is patient developing stiffness or spasticity after stroke, and it occurs in about 30% of patients. Initially after a stroke, patients' muscles can be quite weak and floppy, but as time goes on, they can become quite stiff and inflexible. And the problem with that is it means they lose function, it can be uncomfortable, and it can be painful to try and position it. And we can treat this stiffness with medication, but the problem is that that makes other muscles weak as well. But we have a much more focused treatment using botulinum toxin, which is very effective.
And this is where this is a good use of Botox, unlike the we tend to hear about it for more cosmetic surgery, but this actually has a very good clinical use.
It does. It's well used in neurology. The toxin's injected into muscles, and then after about 2 or 3 days, the muscles become much looser, and we're able to stretch them out and position them much better. And with the Neurotox machine, we can help identify these muscles much more easily. We can stimulate the muscle to identify it, we can get some feedback, and this means it's more effective for the patient, and also it's much more comfortable for the patient. We don't randomly inject their arm, and the benefits seem to occur in the few weeks afterwards. And we probably underuse this treatment. There's good evidence now that if we identify these patients early, so perhaps within 14 days of the stroke, that they benefit in the longer term. And that's perhaps something we've not done so well in Hampshire Hospitals initially, and we're keen to expand this service and hopefully benefit more patients.
Now, this isn't a very expensive piece of equipment, so why is it that it's just not an absolute given that you can get it through your normal NHS budget?
So I think it's really seen as an extra. It's not funded because there's not a lot of spasticity service commissioned by the NHS. There is a regional service, but it is overwhelmed. There are long waiting lists for patients. So anything we can do to try and quicken up that process would benefit the patients, and that's what we're after.
And I think I read that a lot of the patient would otherwise have to go to Southampton. That could come here instead.
Indeed, yeah.
So that's obviously going to create delays, and you've already got big waiting lists at Southampton. So I guess that's going to be detrimental almost to their recovery. Is that right?
Indeed, and often they have to wait months before they can go down and see somebody there, and by that time, sometimes the spasticity is irreversible. They develop a contracture, and then the treatment is no longer effective. And I think if we can identify such patients as inpatients within the first 2 weeks, then that will benefit them in the long term.
So if you obviously if you're watching this video, it's because you're interested in this particular campaign. If you want to help Nigel and his team to help their patients, there's a donate button right next to this vid, and if you click it and donate, all the money will be ring-fenced for the Neurotox machine for Nigel and his team here at Winchester.